Brian Lehrer Show on WNYC. Good morning again, everyone. The epicenter of the ongoing Ebola outbreak is the Democratic Republic of Congo, but this is also a U.S. story because of the Trump administration's withdrawal from global as well as domestic public health. I want to read you a quote from a recent story about the current situation. This comes to us from Amy Maxman, PhD, public health correspondent at KFF Health News. And these are the words of Elizabeth Faraha, a medical director at a clinic in the northeast of the Congo. Quote, "We live with fear in our stomachs. Every day there are healthcare providers and patients dying." So as the Ebola outbreak rages, clinics in the DRC, like the one Dr. Faraha directs, lack protective equipment, tests, clean water, Maxman reports. And this all comes amid the United States' withdrawal from World Health, and at least in part because of it. Though the CDC says that for now the overall risk to the American public and travelers remains low, there are real fears that this outbreak could grow to be Congo's biggest Ebola outbreak ever. So we'll talk about all of this now, domestic and international aspects, with Amy Maxman, who has a long track record reporting on Ebola. She has a new story on KFF Health News with the headline, "We Live in Fear. In Congo, Doctors Face Ebola with Little Protection." Amy, welcome back to the show. We always learn a lot from you when you come on with us. Hi.
Hi, it's a pleasure to be here.
And listeners, any questions or personal connections to the ongoing Ebola outbreak in the Democratic Republic of Congo and Uganda as well, 212-433 WNYC. If we have anybody listening who has experience working on Ebola prevention, perhaps, or treatment, or anybody with ties to the regions affected, you can help us report this story, or anyone may call with a question, 212-433 WNYC. Call or text 212-433-9692. The numbers, Amy, I know only tell part of the story, but what did you reveal in your reporting about the extent of the ongoing Ebola outbreak so far?
So yeah, even though this was only detected a few weeks ago, it clearly has been spreading for weeks and probably months earlier. As of the most recent numbers from June 8th, yesterday, we have 550 confirmed Ebola cases and 101 deaths in Congo and another 19 in Uganda. That's definitely an undercount. There's a real lack of testing. Tests take about 6 days to turn around, is what I heard from doctors in the area, if at all. And then, yeah, like you mentioned in your intro, I had a heartbreaking conversations with doctors who lack like the most basic protection. They're running out of clean water. You know, I talked with somebody who can't afford to put a mattress on the ground for patients, and there's been at least 34 Ebola infections among healthcare workers, and 7 have died. So it's a really terrible situation.
Can you talk specifically about how important tests are? Because my understanding is some Ebola symptoms are fairly common and could be indicators of other things.
Yes, exactly. So we really need tests. I mean, Ebola kind of, at least when it starts out with a fever, vomiting, maybe stomach pain. Those are problems you could have with malaria. Oh, it causes a lot of joint pain, malaria, or other sort of, many other infections. So it's really hard to know that it is Ebola. Now, this means if somebody comes into a hospital, do they have Ebola? So you want to know because you want to separate them from everyone else. But if you can't get a test back, how can you do that? Or how do you know to fully protect yourself, especially when gear is so limited? So tests are really the first key. People always think about Ebola vaccines and Ebola treatments, and yes, that's important, but tests are really foundational.
Are Ebola tests expensive to produce?
No. The trick is because there was a big, basically, a basic lab, like most labs in the U.S., you can test for Ebola. The trick is the labs in Eastern Congo are not well stocked. There was a good one in Goma, kind of the capital of the Eastern Congo, but that fell into disarray when a armed group called M23 took over last year in that area. And so samples need to be sent all the way to the capital city in Kinshasa. And that can take a long time because flights are suspended, roads are really poor. Um, it took 6 days for the first test to even the first samples to get to Kinshasa, and I hear actually the timeline is not much better now.
And you mentioned the military conflict. I mean, as you describe in your story, that's another reason that the response to Ebola is being stifled, right? Like a doctor in Kinshasa told you that moving between remote clinics is nearly impossible because there are so many armed groups. Can you describe the extent of the conflict in the region and how it's wound up helping the spread of the disease?
Yeah, in a lot of ways. And I reported on Ebola from the same area in 2019, and things have, if anything, gotten worse since then. So there's a number of armed groups in the area. It's hard to keep track of it, and governments have sort of neglected all of this conflict. Their government, everybody's governments. It's a really neglected area, and the reason it really helps Ebola is because people are displaced from violence. I think there's been hundreds of people displaced just in the main province where Ebola is, and that means they're on the run, so they're moving, maybe infected. They take the virus with them. They're living in kind of makeshift camps, which are really dense. It also means that what you want to do in an Ebola outbreak is when you find out that somebody has Ebola, health workers go out to wherever they come from and, talk to their family members and maybe see if they can have their family members quarantine or be monitored because they might have Ebola and then spread it. But they're often afraid to go out there when you've got these horrific attacks happening. I talked to another doctor in North Kivu, and he told me that, in addition to kind of treating patients with Ebola, he's had kind of a surge of people come in who are killed or really seriously injured by machetes from a sort of terrorist organization that's there as well.
And you write, researchers at Congo's National Institute of Biomedical Research had built a sophisticated molecular biology lab for surveillance in Goma, the country's eastern economic hub, but the lab stopped functioning last year after the Rwandan-backed armed group M23 violently seized control of Goma and shuttered its airport, stunting the flow of international aid. Unquote. I just thought people might be interested in hearing that exact passage from your article. But
Thanks.
you write, another crippling factor is that the United States is far less involved than in the past. Probably all our listeners know the U.S. has largely withdrawn from World Health. How much has the U.S. pulled back from Ebola prevention specifically in this region?
Both specifically and generally. So last year, the administration cut billions of dollars from aid when it dissolved USAID. And so in a general sense, that money had helped actually supply a lot of health facilities in Eastern Congo. So, if hospitals can't offer treatments, then, they can't really offer a lot of help to patients. So that's part of the reason why this was detected so slowly, or one could see that if, people can no longer go to hospitals. So that's kind of in a general sense. The Trump administration withdrew from the WHO, so the WHO has less money now to respond to emergencies. Remember, they're also responding to crises in Sudan and Gaza and Yemen, so there's a lot of work for them to do. And also, the USAID had put money into surveillance, and that's no longer there. And now the U.S., now that we're not, kind of directly funding the WHO and just directly funding a lot of organizations that have a ton of experience in Ebola, there's kind of these new mechanisms being set up, like to go through the UN agency OCHA. I know this gets pretty wonky in here, but the point is, even if in the end this ends up being a kind of new way to do things, at the moment it's not worked out. So even when the U.S. is giving money, which it's doing, but much less so than in the past, the money's getting out there a lot more slowly, and groups that are traditionally funded by the U.S. told me that they're either frozen or sort of withholding since they're not sure if they'll get money, if they'll get grants to respond.
Right. But talk more about that, because you did write that, quote, under President Donald Trump, the State Department has announced that it will give $350 million to a pooled fund maintained by the UN Office for the Coordination of Humanitarian Affairs, which will then distribute funds to aid groups, unquote. So is this just sort of rearranging the bureaucracy in a way that might kind of work out, or is it something other than that?
Yeah, my sources are right now we're kind of in early days. So first of all, it's not a ton of money compared to, how much Ebola outbreaks cost to respond to. But it could be fine. We go to this other organization of the acronym stands for OCHA. So maybe OCHA now is the one that decides where to put the money. Now maybe that's all right, but this is the first time this is really happening at a large scale. So no one really, this is just adding more, like you said, more steps in the bureaucracy. So it takes time to work that out. And Ebola moves really fast, so time is of the essence. Back to the health workers I've talked to, every day that they're, getting sick or dying from Ebola is less health workers that are there. So every day really counts, and the more this spreads, the more expensive it gets. So this is why we would like to go through what we already know at the moment.
Have you reported on NGOs, non-government organizational aid groups attempting to get the necessary supplies into Congo, CARE, Oxfam, there are a number of them.
Yeah, for sure. Yeah, I've talked with a number of them. Yeah, so like I said, some of them are kind of on hold, thinking that maybe they'll get U.S. funding, but they don't know right now. And this government's so unpredictable, it's hard for them to say, okay, let's just go into debt for this and assume we'll get the money later. So yes, a lot of them, there's some other ones that, you named some, there's other ones, there's the Red Cross, there's a group called ELIMA, Doctors Without Borders is there, but they don't rely on the U.S. But yeah, so they're kind of frozen right now because of this.
I guess
Yeah, I
there's
think
a
I forgot
lesson
the
in
beginning
that.
of your question.
Right. No, that's okay. Well, I guess there's a lesson in that for people who, maybe get donation-seeking mailers from some of these groups, not realizing how dependent they are to some degree or have been on government support, right? Rather than them
Yes.
just being private, detached from government aid organizations. They're private aid organizations, non-government organizations, as we say, NGOs, but dependent on U.S. and I presume other Western or wealthier government support to do what they do at the level that they do it.
Exactly. Like and to talk about, how I said some are frozen, but some are withholding. I talked with the Catholic Relief Services. They're actually doing they usually get a fair amount of U.S. money. They're kind of doing sort of interesting work. They are working with this group Caritas. It's another Catholic organization that is very well placed in the Eastern DRC, who works directly with priests in the area. So they're able to kind of over even like WhatsApp and messages kind of give advice, teach the priests about what's going on. The priests can teach other people, figure out what's happening in like these remote health centers. They're trying to send supplies through these networks. It's really interesting, but they could do a lot more if they had more money.
Listener asks, can you please ask the guest to explain how Ebola is transmitted?
Yes, that is an important question. So mainly through touch. So when people are very sick or when they've just died, the virus lives in liquids that are kind of excreted in liquids. So like sweat, vomit, blood. So if you touch a person who's in the very late stage of the disease or has just died, it's very transmissible at that point. I can tell you, I spent 3 months in Sierra Leone during the world's worst Ebola outbreak, and I wasn't that nervous because I wasn't going into Ebola treatment units where people are really sick, and I wasn't intentionally going into very crowded places where I'd have to touch a lot of people. It is absolutely not spread through the air, and it's not going to suddenly mutate to become airborne, so that's not something to worry about.
We haven't really touched on Uganda, which is another side of this outbreak. Is the situation there materially different?
I mean, there's been a lot less cases. I would say Uganda tends to have kind of a higher quality, like their health system's a little bit, it's in better shape. That said, I think most, of the researchers I've talked to think there's probably, definitely been undetected cases in Uganda. So that's possible, and it's even likely, or if it's not already there, that there's other neighboring countries that might have some Ebola cases. But yeah, I think I'm a little less worried about Uganda, but certainly it's there and it's been to the capital. So a person who went all the way to Kampala traveled by ground, so they might have infected people along the way.
What would it take for it to spread to the United States? And what are the prudent prevention steps that have been taken in the past domestically, and are they being taken today?
I would say the short answer is no, they're not being taken. I think, I think it is prudent that when people return from countries with Ebola outbreaks, that they're screening at airports. When I came back from Sierra Leone, people kind of greet you in white suits, their big white Tyvek suits at the airport and give you a thermometer and they give me a flip phone and this is the CDC or the local health department in New York, called every single day to ask me. I just take my temperature twice a day for 21 days and give them my temperature. And, if it had gone up, then they would have taken further steps. I think that's a prudent approach. You want to balance kind of being safe with also making sure that if there's Americans who want to report on the Ebola outbreak, or more importantly, do something and respond to it, that they can go and that, this country will welcome them back like the heroes that they are. And I'm talking about health workers. Mm-hmm. But right now, what the Trump administration's approach really seems focused on really just travel bans that seem to be more based on sentiments about immigration than public health, quite frankly. So the U.S. is blocking what they call foreign nationals, people who are residents of the U.S. but aren't full citizens, from returning to the U.S. for 21 days if they've been to Uganda, Congo, or Sudan. So they're not allowed to come back. And it seems like even Americans, there was an American missionary doctor who got Ebola, and then some of his colleagues who were, working around Ebola people with Ebola, I should say. So he was sent to Germany, and they were sent to the Czech Republic. We've got wonderful facilities to treat Ebola in the U.S., but it seemed like the idea is just don't let them back here. The State Department's talked about setting up a treatment union in Kenya where Americans could go. I think it sounds like Kenya said, what? No thanks. So this kind of approach could backfire because I think, if you put yourself in the shoes of someone who would like to go help, the idea that you might not be allowed back home for, a few weeks is a deterrent.
And I'm glad you used the word heroes to describe some of these healthcare workers. I think we can take healthcare workers for granted too much sometimes. And, it makes me think of that period of time early in the COVID-19 pandemic when people used to gather at their windows and wherever at, I think it was 7 p.m. and, just do a sort of community round of applause for all the healthcare workers who were putting their own lives on the line by dealing with all the COVID-19 patients who are coming into the emergency rooms and everything else. And we forget, right? I mean, it seems quaint now maybe to make that reference, but it wasn't just that moment and it wasn't just that disease.
Yeah, truly. I mean, it's incredible what they do, and it breaks my heart when I talk with them and hear about the conditions that they're expected to work in. I mean, people tend to not want to be martyrs.
Listener writes, I work for IAVI, an NGO that is currently leading a BDBV, not sure what that is, vaccine development.
Probably the name of this virus is a little different than a lot of other Ebola viruses. The Bundibugyo virus.
I see. So that's a particular kind of Ebola that they're working on a vaccine for. And listener writes, I can confirm that the U.S. is completely absent in vaccine development funding and actually slashed our budget by $6 million during the DOGE cuts last year. So
wow, fascinating. What's the group? Can you tell me the name of the group again?
Looks like the initials IAVI.
Oh yeah. Yes, they're well known. Yeah.
So
how about that?
Well, there's a tip. You can report on that for KFF Health News as your next story. I do hear you have if you want to just say something briefly, or maybe you don't want to scoop yourself. I'm told you have a measles story coming out. Anything new on that you want to at least tease before you go?
Sure. And actually, it came out in Wired. So KFF Health News partners with other outlets. So it came out in Wired today and out in KFF tomorrow. So I'm happy to talk about it. Yeah, this, we've hit the 2,000 mark for number of cases in the U.S. this year. And that's only in the first 6 months. This is kind of up around where we were last year, which was the most since 1992. So measles is really coming back in the U.S. And so I wrote a piece. I went to Utah to report this, where they've had an outbreak for 10 months. And sort of, what I found in that is just sort of, I wrote about the toll this takes. So we always hear about case counts, but beyond just like the, just number of people who get measles, it really just sort of, the story is just about how it, just burdens a whole bunch of stuff. It burdens schools, it burdens hospitals tremendously. It costs a lot to, both for medical care and for the health system. I talk to a lot of mothers and parents who are super anxious, if they have to send their child to daycare when they're too young for vaccines. They're very nervous about this. There's people who are immunocompromised who, when measles is just common and spreading in the community, they're kind of in a state of high alert. So that's what that story is about.
I see it now. Headline, Anguished Parents, Crying Doctors, Life Amid Utah's Measles Outbreak. And the subhead, which says a lot, is the state's outbreak means adapting to America's new reality in which vaccine-preventable diseases become common again. So with that subhead, we will leave it with Amy Maxman, public health correspondent at KFF Health News. Amy, thank you so much for great, if depressing, information.
Thank you so much.